Hi, my name is Justice Kaigler, and the presentation that you're watching today is going to be covering the topic of schizophrenia. Schizophrenia is a mental illness characterized by the patient being out of touch from reality in thoughts and behaviors, as well as them having disorganized speech and thoughts. People who are diagnosed with schizophrenia may experience delusions and hallucinations. They will often have difficulty with daily activities and impaired cognitive functioning. Schizophrenia is a chronic illness that often requires lifetime therapy and psychiatric medication for symptom management. In this lecture, I will be covering the symptoms of schizophrenia as well as the onset, the process of diagnosis, the prevalence, etiology, and treatments. I'm now going to discuss the symptoms of schizophrenia. There are three different symptom classifications for schizophrenia. There are positive symptoms, negative symptoms, and cognitive symptoms. Positive symptoms are called positive symptoms because they are adding to the patient's daily lives. They are the addition of thoughts or behavior as a result of the disorder. One positive symptom is disordered thought. Schizophrenics can experience disruptions of thought processes. This will often impair their ability to hold a coherent conversation. They will dart from topic to topic even if they are completely unrelated, and they have a hard time concentrating and answering questions. They often repeat sentences and ideas without the need to. They can also make up their own words and noises and believe that others can understand them. Another form of positive symptoms are delusions. There are many different types of delusions. Delusions are false beliefs. They do not involve any form of sensory input. They are just ideals that a schizophrenic patient believes in regardless of proof against it. There are two types of delusions: grandiose delusions and persecutory delusions. Grandiose delusions consist of a false belief that you are special without any real evidence to back it up. People experiencing grandiose delusions will often think that they have been given special powers. Some people will believe that they can change the weather when they are obviously not able to do so. Other types of grandiose delusions consist of delusions about religious figures. Patients will often think that they were gifted or sent by God to the world. The religion-based grandiose delusions can often be affirmed by auditory hallucinations of God speaking to the patients. The most common type of delusion is a persecutory delusion. People experiencing persecutory delusions might believe that someone is conspiring against them or spying on them. They will often believe that higher power, like the government, is out to get them. They can become convinced that they are in immediate danger, that someone is trying to poison, drug, or kill them. They can even be convinced that the government, aliens, and other groups are trying to microchip them or kidnap them. They can even become convinced that co-workers or significant others are out to get them. They can become convinced that coworkers are conspiring against them or their significant other is cheating, even if there is no evidence to that fact. Another positive symptom has to do with movement. Some schizophrenic patients suffer from what is called movement disorders. They can have agitated, sudden body movements, and they will seem unable to become comfortable. They will often fidget and be unable to sit still. The last type of positive symptom is a hallucination. Hallucinations are sensory experiences that occur without any stimulation from outside sensory objects. This can include hearing voices, seeing figures, and tasting, touching, or smelling something that isn't actually there. Negative symptoms in schizophrenia are defined as the removal of certain behavior in the patient's life. This can be seen as the subtraction of so-called normal human behaviors that impair a schizophrenic's ability to function well in standard society. They can suffer from what is called a flat effect, where they are very emotionless and flat when they experience normal life things. They can also experience reduced pleasure, overall life impairments, and lack of speech. Another form of schizophrenia symptom is a cognitive symptom. Schizophrenia patients often experience cognitive difficulties, but these difficulties vary in severity from case to case. These difficulties can affect any cognitive function, including daily functions like memory, task performance, and general thinking skills. This can lead to things like poor executive functioning, difficulty making decisions, problems focusing, and working memory impairments. That means that schizophrenics can have a hard time remembering what project they were doing and how they were going about it. The average onset of schizophrenia in males is 18 years of age, while in females it is 25 years of age. Diagnosis for patients under 10 years of age and over 40 is extremely rare. The 12-month prevalence for schizophrenia is 1.1%, which means roughly 3.6 million people in the U.S. are affected by schizophrenia in the past 12 months. The process of diagnosis. There is no simple way to diagnose schizophrenia. At this point in time, there is no test or scan that can completely confirm or create a schizophrenia diagnosis. The diagnosis of schizophrenia requires the presence of clear-cut schizophrenic symptoms that have been present for at least a month. The patient must have also been suffering from general disturbance of their mental health 6 months prior to the diagnosis. Schizophrenia is diagnosed by an interview. Since there are no physical tests to diagnose schizophrenia, patients must undergo mental testing. This mental testing is a structured interview administered by a psychiatrist. These interviews are not conducted by general practitioners because they are not specialized enough to accurately diagnose such a severe mental disorder. These interviews are highly structured and fully assess the patient's cognitive well-being, mental clarity, and daily functioning. The diagnostic criteria of schizophrenia requires the following: clear-cut symptoms present for at least 1 month, 6 months of previous mental and/or physical disturbances related to the later onset symptoms. The present symptoms must be impairing to daily life functions. Other potential causes for this disorder, like drugs, must be ruled out. The early signs of schizophrenia include withdrawal from friends, family, and general social engagements, trouble falling and staying asleep, lower school and work performance, sudden shifts in moods and irritability, lack of motivation and drive. Psychiatrists look for a variety of different changes in individuals' life when considering a diagnosis of schizophrenia. They look at the patient's social functioning to see if they are withdrawing from friends or family. They also look at the daily functioning of the patient to see if their normal behaviors are impaired. Psychiatrists look into the recent ideas and projects the patients have been pursuing to see if the patient is having delusional beliefs or ideas about the world around them. They are looking to see if the patient is having any newfound persecutory delusions. Psychiatrists examine the behaviors their participant has been exhibiting. Has the patient been a harm to themselves or others? Do they have the potential risk to be? Have they recently been getting into trouble with law enforcement or other authority figures? Have they been taking care of themselves, or are they acting recklessly? Psychiatrists look at the emotional stability, the rationality the patient is experiencing. They might ask, is the patient exhibiting the proper emotional responses to stimuli? Is the patient agitated or irritated for no reason? Psychiatrists might also ask if the patient has been taking care of themselves recently. Have they been showering, grooming, etc.? Has the patient experienced a sudden decline in their school, work, or social performance? They also look at the patient's behavior even further to see if the patient has experienced any drastic change in their interests. They want to make sure that the patient's sleep schedule and work schedule has remained the same. The current diagnostic accuracy for schizophrenia is around 90%. In the past, the accuracy of a schizophrenia diagnosis was much lower. To improve the accuracy, the specific details for a schizophrenia diagnosis have been refined. Efforts to interview not only the patient but also the family can be beneficial. The exact etiology of schizophrenia is unknown because one single cause has not been discovered yet. There are currently theories about where schizophrenia originates, and there is research about at-risk groups, but no specific cause has been found. There are genetic trends in schizophrenia. If you have a family member that's schizophrenic, you are more likely to develop the disorder. There are also brain differences between schizophrenic and neurotypical patients. Schizophrenics have reduced gray matter in their frontal and temporal lobes. Scientists are not exactly sure of how, but they are convinced that neurotransmitters have something to do with the etiology of schizophrenia. Antipsychotic drugs that are often used to treat schizophrenia do mess with some neurotransmitters, which is why they are said to be linked. The treatment goal for schizophrenia is to help the patient live the happiest, most stable life possible with their diagnosis. The two leading treatments are antipsychotics and psychosocial treatments. Antipsychotics are the leading long-term treatment for schizophrenia. They are pharmaceutical drugs and can lead to harmful long-term side effects. They can be injected or taken orally. Psychosocial treatments are normally started after a schizophrenic patient is relatively stable on a medication. This involves integration into society, advancement of life goals, and familial support. Schizophrenics are often taught how to integrate into society after a psychotic episode. They are taught how to maintain job security, how to cope if they think another psychotic episode has started, and how to maintain close relationships among peers. Another goal of psychosocial treatment for schizophrenia is to help the patient live as full of a life as possible. Often, counselors will attempt to sit down and plan the future with the patient to help advise them along the way to fulfilling their ideal life. Therapists will often contact the family of the patient to see what kind of support group the patient has. Therapists do their best to inform the family of the patient about schizophrenia to ensure they fully understand the disorder. Thanks for watching.